Good afternoon, all of you. Okay, just confirm whether the audio and visual is correct. It's fine on your end. Can you people hear me properly? अरे बाबा, हम comments बाद में पढ़ेंगे. पहले just let me know that am I audible to you, all of you? Okay, great. Thank you, Zayed, for telling me that. Muskan, yes, this series is for upcoming July FMG exam. We really don't know whether the FMG exam is going to happen in December or not, and whether this July FMG is the last FMG. So you don't have to leave any stone unturned to clear this exam. This should be a prime goal कि इस बार तो हमें एग्जाम क्लियर करना ही करना है, right? And this is why I am taking these special classes, because OBGY is one of the very important and a scoring subject for your upcoming FMG exam. ठीक है, चलो. So let's begin with a very important topic, and that is abruptio. Now abruptio is not as tricky as placenta previa. बहुत plain and simple management भी होता है abruptio का, and बहुत plain and simple discussion है abruptio का. Entire abruptio will be covering today in short. Babu Sahuta, yes, abruptio is very important for your upcoming NORCET exam also, right? So this topic is very important for NORCET, and this topic is also important for upcoming FMGE. ठीक है, चलो, let's begin. What has happened? Okay, now today I thought I myself am going to use my one touch notes to do abruptio with you. So many of you keep on asking me in my mailbox. I get so many queries that, ma'am, how to use one touch for FMGE. You know, whether you are FMGE student, whether you are a NEET PG aspirant, one touch में whatever you need to clear your exam, whatever obs and gynae is required so that your last minute revision can be done and you can cover everything in a short span of time, is there in one touch, right? One touch में you are going to get every topic, all topics. I have not done this कि कुछ topics cover करे हैं. I have covered every topic in one touch in the shortest possible manner, right? So if you see over here in this one page, I have covered the entire topic of abruptio, and now I'm going to use it for my class today, and you will see how you are going to use one touch for revising a topic like abruptio. So this box over here, first box is about history, that what history is a patient going to give you when she is a case of abruptio. So as we know, abruptio is a case of one of the most common reasons for antepartum hemorrhage. So patient is going to come to you with bleeding PV in third trimester. अब ये जो bleeding PV होगी third trimester में, there will be associated pain in abdomen. This is what is different from placenta previa. Placenta previa में bleeding never had pain, right? It was a painless bleeding. But in case of abruptio, she is going to come to you with complaint of bleeding PV, and she is going to come to you with complaint of pain in abdomen. One thing. Number two, patient history देगी हमें कि there was some trauma जिसके बाद ये bleeding start हुई, or she has high BP and she is having bleeding in third trimester. So definitely आपको हिस्ट्री मिल रही होगी कोई abdominal trauma की, या कोई कार एक्सीडेंट की, या पेशेंट गिर गई, या किसी ने उसको हिट किया, some kind of trauma की हिस्ट्री मिलेगी, Yeah, some kind of high BP. Patient will have high BP, and that is what has led to this bleeding in third trimester. This is very different again from placenta previa. Why? क्योंकि placenta previa में what did I tell you? Placenta previa में there is causeless bleeding, there is painless bleeding. Then abruptio के केस में जो bleeding का color होगा that will be dark red in color. Whereas in placenta previa the color of bleeding is bright red in color. It's a fresh bleeding. Abruptio में it's collected blood. Right? Then in case of placenta previa, you typically get the history कि 2 दिन पहले bleeding हुई, then it stopped and now the bleeding has started again. Right? But in case of abruptio, bleeding is not recurrent. You will never get this history कि 2 दिन पहले bleeding हुई थी and now the bleeding and फिर वो रुक गई and again the bleeding has started. This kind of history you don't get in abruptio. Why? Because just now I will tell you कि once abruptio happens, एक बार जब abruptio होता है and the placenta separates. What is abruptio? Abruptio, as I told you in the first lecture, that the placenta separates prematurely. Normally, a placenta should separate after the delivery of the baby. In this case, placenta separates before the delivery of the baby, right? So, whenever a placenta separates prematurely, there is release of thromboplastin, right? So, this is there in your one touch as well. See over here. Placenta separation releases thromboplastin which initiates uterine contractions. So, एक बार bleeding होती है अगर abruptio में, एक बार placenta separate करता है अगर abruptio में, then that results in the process of labor, right? So, ultimately patient deliver कर जाता है. So, you never get this history in abruptio that I had bleeding 2 days back and now again I have bleeding. No, this kind of history you don't get in abruptio, which means bleeding of abruptio is not recurrent and you don't get any warning hemorrhage, right? So you don't get any warning hemorrhage. So I am repeating, in case of abruptio, bleeding के साथ साथ pain मिलेगा. There has to be some reason for that bleeding, right? Blood will be dark red in color. The bleeding will not be recurrent and there won't be any warning hemorrhage. Clear? Okay. Now, coming to the types of abruptio. So, the types of abruptio. Basically, there are 3 types of abruptio. Number 1 is where the placenta, green color is the placenta and this placenta has separated from the uterus. So, this black line is the uterus, green color is the placenta. Placenta has separated from the uterus but in such a manner that it is not allowing blood to come out, right? Whatever blood is collecting behind the placenta inside the uterus. Right, so whatever blood is collecting inside the uterus. This kind of abruptio is called as concealed hemorrhage. Concealed hemorrhage. Right? Another variety of abruptio is where the placenta separates in such a manner. So over here, placenta has separated in such a manner that whatever blood is collecting, this blood is going to get space to come out, right? And this is what is called as revealed hemorrhage. And a third variety is mixed. Mostly you get mixed varieties, right? Most of the times you are going to get mixed variety of abruptio, right? So, we have concealed variety, we have revealed variety and we have mixed variety. Another very, very important thing which I want all of you to remember, because trauma is a risk factor for abruptio, because trauma can lead to abruptio, right? That is why it is also called as accidental hemorrhage. Accidental hemorrhage. So the other name for abruptio is accidental hemorrhage. There is one more name for abruptio. What is that name for abruptio? Uterine apoplexy. Uterine apoplexy. These are names for abruptio. So what are the other names for abruptio? Accidental hemorrhage and uterine apoplexy. So instead of writing abruptio, if they write accidental hemorrhage, it means they are talking about abruptio, right? Now, so over here in your one touch it is written abruptio is premature separation of a normally situated placenta. Here the placenta is normally situated, and where is a placenta normally situated? A placenta is normally situated in upper uterine segment. So there is a revealed variety, that means whatever bleeding occurs comes out, and there is a concealed type of a hemorrhage where blood collects inside the uterus behind the placenta. And जब blood collects inside the uterus behind the placenta, तो ऐसा लगने लगता है कि the entire uterus has got bruises. And such a uterus is called as covular uterus. So what is a covular uterus? Covular uterus का मतलब है कि concealed variety में blood has collected inside the uterus, and एक बार वो uterus में जब collect होता है it enters into the myometrium, and पूरा का पूरा uterus ऐसे लगने लगता है जैसे there are a lot of bruises on the uterus. That is what is called as covular uterus. So look at this uterus over here. Do you see over here? It is appearing as if this entire uterus has got bruises. So they ask you two questions on covular uterus. Number one, in which condition do you get covular uterus? So covular uterus is seen in concealed variety of abruptio. It's seen in concealed variety of abruptio. Number one. Number two, they ask you that in case of covular uterus, right, are you going to do hysterectomy? Are you going to do hysterectomy for a covular uterus? So you are going to answer this and tell me. Suppose I am just now going out and chalte chalte I fall down, right? Or I hit this door behind me and I get a bruise on my forearm, right? How many of you are going to say कि मैम आपके तो bruise हो गया, go get your arm amputated? How many of you are going to say that? चाहे एक bruise हो जाए, दो bruise हो जाए, तीन bruise हो जाए, how many of you are going to say कि मैम oh God आपके तो bruise हो गया, get your arm amputated? Are you going to do that? No. So then if uterus has got bruises, are we going to remove the uterus? No, right? So covular uterus, it is not an indication. It is not an indication for hysterectomy. Very, very important point. It's not an indication for hysterectomy. Clear? Okay. Then, now what are you going to get in per-abdominal findings in case of abruptio placenta? So before I tell you the per-abdominal findings, I want you to write over here, whenever placenta separates, what is released? Thromboplastin is released, right? और ये thromboplastin क्या करेगा? ये thromboplastin uterus को contract कराएगा, ये thromboplastin labor initiate करेगा, and ये thromboplastin DIC कराएगा, right? So it is going to make the uterus contract, it is going to initiate the process of labor, and it is going to start the process of DIC, right? So in case of abruptio, what is going to happen? How on per abdomen हमें कैसा uterus मिलेगा? If thromboplastin is making the uterus contract, so uterus will be tensed, uterus will be tender, and it is going to be rigid. And अगर यूट्रस टेंस्ड है, यूट्रस टेंडर है and यूट्रस रिजिड है, am I audible and visible? I think I'm stuck somewhere. No. Okay. Why it is showing on my phone that everything is stuck? I hope everything is fine and you people can hear and see me. Can you tell me through live chat? Okay, okay, thank you. Great, chalo. So, because of this thromboplastin, uterus is tense, tender and rigid. Now tell me, if uterus is tensed and tender, will you be able to listen to fetal heart sounds? No, fetal heart sounds are not heard. And because uterus is so tensed and tender, that is why fetal parts are not palpable. Now, because the most common type of abruptio is mixed variety, that is a combination of revealed and concealed may blood collects inside the uterus, so the height of the uterus will be more than the period of gestation, right? Why? Because blood is inside the uterus. So height of the uterus will always be more than the period of gestation. Right? So these are per abdominal findings. In contrast, placenta previa में क्या होता है? In contrast, placenta previa में height of the uterus is always equal to the period of gestation. Uterus कैसा होता है? Relaxed होता है, soft होता है, non-tender होता है. Because uterus soft है, relaxed है, non-tender है, so fetal heart sounds are easily heard and fetal parts are easily palpable. Clear to all of you? Yes? Okay. Now comes per-vaginal examination. Is per-vaginal examination contraindicated in abruptio also? No. Right? Per-vaginal examination is not contraindicated in abruptio, but there is an important but over here, and that but is always you should be doing per-vaginal examination in abruptio after ruling out placenta previa. After you are very sure that you are not dealing with a case of placenta previa, then only you should be going for per-vaginal examination in abruptio. Right? Okay. So, should you be doing a per-vaginal examination? It can be done, I agree. But should you be doing a per-vaginal examination? Yes, per-vaginal examination is very important in abruptio. Why? Why is per-vaginal examination so important in abruptio? Why is it? This is because just now I told you that whenever placenta separates, thromboplastin release hota hai. And जब thromboplastin release hota hai, then the process of labor is initiated. So in a patient who has come to you with abruptio, the patient will already be in labor. So you have to check the dilatation of the cervix. And that can be done by doing a per-vaginal examination. So yes, per-vaginal examination is mandatory in patients of abruptio, but it should be done only after ruling out placenta previa. Now, investigation of choice, there is no investigation of choice. If you want to do, you can go for TVS. TVS में क्या मिलेगा? You will see placenta in upper segment. You may get a retroplacental clot, or you may get something which is called as a jello sign. And details of jello sign not required for FMG. Just remember this, कि retroplacental clot मिल सकता है, placenta will be seen in upper segment and jello sign मिलेगा. Right? Remember, abruptio की diagnosis बनाने के लिए TVS is not mandatory. Right? So rather than saying it is not diagnostic, it should be written it is not mandatory. Why? Because abruptio is a clinical diagnosis. Right? Clinically, you can diagnose abruptio and it is a clinical diagnosis. Till here it is clear. Now coming to classification of abruptio. So classification of abruptio को कहते हैं, this classification was given by Page and this is called as Page's classification. Now in Page classification there are three grades, there are four grades, grade 0, grade 1, grade 2 and grade 3, right? Grade 0 का मतलब है कि it's a retrograde diagnosis. Retrograde diagnosis का मतलब कि एक बार पेशेंट की डिलीवरी हो गई एंड उसका प्लेसेंटा बाहर निकला एंड आई एम सीइंग ओ माय गॉड देयर इज अ रेट्रोप्लेसेंटल क्लॉट. इसका मतलब ड्यूरिंग प्रेगनेंसी इसको एपीएच हुआ था एंड पेशेंट मेरे पास आई नहीं, या उसको इतनी कम ब्लीडिंग हुई कि शी डिडंट फील द नीड टू कम टू मी, राइट? सो इफ इट इज अ रेट्रोग्रेड डायग्नोसिस, आफ्टर डिलीवरी आपको पता लगता है ओ अच्छा पेशेंट के एब्रप्शियो हुआ था, okay, the placenta is showing a retroplacental clot, that means कि इतना severe abruptio था ही नहीं, and that is what is grade 0. Now in all cases of abruptio, what are the clinical signs and symptoms which you get? I told you two clinical signs and symptoms. One is bleeding, other one is pain, right? Now bleeding and pain तो grade 1 में भी मिलेगा, grade 2 में भी मिलेगा, grade 3 में भी मिलेगा, लेकिन डिफरेंस क्या है? ग्रेड 1 में फीटल हार्ट साउंड्स नॉर्मल होंगे, ग्रेड 2 मींस जब फीटल डिस्ट्रेस मिले, एंड ग्रेड 3 मींस फीटल डेथ मिले. सो ब्लीडिंग एंड पेन के साथ साथ अगर फीटल हार्ट साउंड्स नॉर्मल है, दैट मींस इट इज ग्रेड 1 एब्रप्शियो. इफ देयर इज फीटल डिस्ट्रेस, इट मींस ग्रेड 2 एब्रप्शियो, एंड इफ देयर इज फीटल डेथ, राइट, then that means it is grade 3 abruptio. Right, so Page classification says grade 0 का मतलब है retrograde diagnosis, grade 1 का मतलब है bleeding and pain तो मिलेगा ही grade 1, grade 2, grade 3 में. Grade 1 means fetal heart sounds normal, grade 2 means fetal distress seen, grade 3 means fetal death occurs. Clear? Okay. Now, again this is what I have written over here. Placental separation releases thromboplastin which initiates contractions and it leads to DIC. So what is a complication of abruptio? A complication of abruptio is DIC. Now another very important question is, what are all the obstetrical conditions which lead to DIC? ऐसी कौन कौन सी obstetrical conditions होती हैं which can lead to DIC? Number 1, abruptio, which is the most common. Number 2, intrauterine death of the fetus. Number 3, amniotic fluid embolism. Number 4, septic abortion. Number 5, severe preeclampsia or eclampsia or HELP syndrome. So these are the conditions, obstetrical conditions which lead to DIC. 5 conditions जो याद रखनी है. Number 1, abruptio, that is the most common. Number 2, intrauterine death of the fetus. Number 3, amniotic fluid embolism. Number 4, septic abortion. And number 5, severe preeclampsia. PE is preeclampsia, E is eclampsia, and then HELP syndrome. Clear to all of you? Yes. Now, जब abruptio होता है and thromboplastin release होता है, so thromboplastin initiates contractions, and these contractions lead to the process of labor or they can lead to the process of preterm labor. Right? अगर ये contractions 37 weeks के बाद हो रहे हैं, यानी कि placenta का separation is happening after 37 weeks, it is going to lead to labor. If this is happening before 37 weeks, it is going to lead to preterm labor. This means that in all cases of preterm labor, whenever you are getting uterus is tensed, tender and rigid, जब भी ऐसी फाइंडिंग मिले प्रीटर्म लेबर में, यू शुड सस्पेक्ट कि ये प्रीटर्म लेबर इज हैपनिंग बिकॉज ऑफ एब्रप्शियो. सो इन अ पेशेंट ऑफ प्रीटर्म लेबर, if the uterus is tensed, tender and rigid, then always suspect abruptio. Abruptio is one of the very important causes of preterm labor. Clear to all of you? Yes? Okay. Now, management of abruptio. अब जैसे प्लासेंटा प्रिविया का मैनेजमेंट किया था, इन प्लासेंटा प्रिविया आई टोल्ड यू दैट यू हैव टू ऑप्शंस. वन इज एक्टिव मैनेजमेंट कि हम इमीडिएटली टर्मिनेट कर दें प्रेगनेंसी. द अदर वन इज एक्सपेक्टेंट मैनेजमेंट. In case of abruptio, most commonly we go for active management. Why? Why we most commonly go for active management? Because of two reasons. Number one, because patient will already be in labor. Most of the times thromboplastin release होने की वजह से patient will already be in labor. Number two, thromboplastin release होने की वजह से there are increased chances of DIC. राइट एंड जितना ज्यादा हम प्रोलॉन्ग करेंगे प्रेगनेंसी को, देर आर इंक्रीज चांसेस ऑफ DIC. राइट, सो वेरी रेयरली वी गो फॉर कंजर्वेटिव मैनेजमेंट. देर इज ओनली वन कंडीशन वेयर आई एम गोइंग टू टेल यू कंजर्वेटिव मैनेजमेंट. इसके अलावा एवरीवेयर यू हैव टू गो फॉर एक्टिव मैनेजमेंट. Till here, have you understood? This is a very big difference between management of placenta previa and abruptio. Placenta previa में expectant management भी करते हैं, active भी करते हैं. In case of abruptio, mostly you go for active management. Very rarely you go for expectant management, and there is just one condition. Number one. Number two, placenta previa में I told you active management का मतलब है always cesarean section, right? This is not the case in abruptio. In abruptio, active management का मतलब है either cesarean section या induction of labor. You can do vaginal delivery, you can go for cesarean section, depending upon the question which is given to you. Right? So, abruptio में you may go for vaginal delivery, you may go for cesarean section. Abruptio में every time we go for active management, that means या तो हम question का answer cesarean देंगे या हम question का answer induction of labor देंगे, except in one condition. Right? So, let us see over here. Suppose आपको question दिया, and these things you will be able to answer yourself. आपको question दिया है कि patient को abruptio है and fetal distress है या मदर की कंडीशन अनस्टेबल है. Now, as I told you, abruptio में always go for active management. Now, tell me, fetal distress हो रहा है या मदर की कंडीशन अनस्टेबल है, are you going to go for vaginal delivery या cesarean section? ज़्यादा quick क्या है? Cesarean section, right? So, you are going to say that my next step will be emergency cesarean section, right? Now, abruptio है, fetus की death हो गई है, right? Fetus is dead. But your question says that mother is unstable या DIC हो गया है. Please remember, DIC के केस में these days the management is cesarean section. Whenever your patient is having DIC, we manage it by cesarean section, right? So, जब भी DIC होगी, management is cesarean section, but before you do cesarean section, you have to first correct DIC and then do cesarean section. Right? So, जब भी DIC होगा, हम सबसे पहले DIC को correct करेंगे and then we will do cesarean section. ठीक है? So, suppose your question is saying कि abruptio है and साथ में fetus की death हो गई है, but mother is unstable या mother has DIC. See, normally क्या होता है? Whenever baby is dead, we prefer not to do a cesarean section. Why? क्योंकि एक तो baby dead है and then we are doing a cesarean section. So, mother के लिए double trauma है कि cesarean भी हुआ and dead baby भी निकला. Right? But यहाँ पे question is telling you कि mother की condition unstable है या mother को DIC है. And I told you, always as an obstetrician, our aim is to save the life of mother. तो मदर की क्योंकि कंडीशन अनस्टेबल है या मदर को DIC है, दैट इज व्हाई आई विल नॉट गो फॉर वेजाइनल डिलीवरी इवन दो द बेबी इज डेड. आई एम गोइंग टू गो फॉर सिजेरियन सेक्शन. आर यू अंडरस्टैंडिंग? सेम क्वेश्चन इफ दे गिव यू एंड दे से कि एब्रप्शियो है, फीटस की डेथ हो गई है बट मदर इज स्टेबल, कोई DIC नहीं है, मदर इज स्टेबल, then in that case I will prefer vaginal delivery. So induction of labor for vaginal delivery, right? Next case is question में केवल ये दिया है कि एक abruptio की patient has got DIC. What is the management? Management is correct DIC followed by cesarean section, right? Question में दिया है कि जेस्टेशनल एज मोर देन इक्वल टू 34 वीक्स है, मदर भी स्टेबल है, फीटल हार्ट साउंड्स नॉर्मल है, कुछ नहीं और दिया, राइट? फीटल हार्ट साउंड्स एब्सोल्युटली नॉर्मल दी हैं, मदर स्टेबल दी है, राइट? देयर इज नो DIC, नथिंग. नाउ अगेन एक्टिव मैनेजमेंट तो करना है, बट यहां पे क्या सिजेरियन करना है? नहीं, कोई नीड नहीं है, मदर भी स्टेबल है, कोई DIC नहीं है, कोई फीटल डिस्ट्रेस नहीं है. So the answer becomes induction of labor followed by vaginal delivery, right? Now comes that only one condition जहां पे आप conservative management करोगे, expectant management करोगे, that is if your question is saying patient has abruptio, there is no emergency condition, mother की stable, mother के vital stable हैं, fetal distress नहीं है, कोई DIC नहीं है, absolutely stable condition hai, and there is no emergency condition, and gestational age is less than 34 weeks. That is the only time when you are going to say that I will continue pregnancy rather than saying कि I will go for vaginal delivery. So there is only one condition जब आप expectant management करते हो in abruptio, that is if the gestational age is less than 34 weeks, mother stable है, fetus stable है, right? And there is no DIC, then you are going to continue her pregnancy and you are going to go for conservative management. Otherwise, always in abruptio, you have to go for active management. Active management could be cesarean section, it could be vaginal delivery, depending upon the situation. फीटल डिस्ट्रेस है तो सिजेरियन सेक्शन, मदर के वाइटल्स अनस्टेबल हैं तो सिजेरियन सेक्शन, DIC है तो सिजेरियन सेक्शन, इनमें से कुछ भी नहीं है तो विजाइनल डिलीवरी. फीटस की डेथ हुई है एंड मदर भी स्टेबल है एंड DIC नहीं है तो विजाइनल डिलीवरी. फीटस की डेथ हुई है लेकिन मदर अनस्टेबल है या DIC है तो सिजेरियन सेक्शन. हैव यू अंडरस्टूड ऑल ऑफ यू? Yes? So that is what you have to remember in case of abruptio. Quickly, I want to tell you 2-3 important points on DIC. DIC. What is DIC? DIC is consumptive coagulopathy. DIC में क्या होता है? पेशेंट को ब्लीडिंग होती है, पेशेंट हैज ब्लीडिंग, right, due to any reason, due to some reason, and to control this bleeding, clotting factors come into action. क्लॉटिंग फैक्टर्स एकदम से आ जाते हैं कि ओके ब्लीडिंग हो गई है, लेट मी स्टॉप दिस ब्लीडिंग. नाउ व्हाट हैपेंस इज कि ब्लीडिंग इतनी ज्यादा है दैट देयर इज एक्सेसिव ब्लीडिंग. So due to this excessive bleeding, all clotting factors get consumed. All clotting factors are consumed. Right? And this is what is called as consumptive coagulopathy. This is what is consumptive coagulopathy. Are you understanding this? Yes. So ब्लीडिंग हो रही है पेशेंट को, उस ब्लीडिंग को रोकने के लिए क्लॉटिंग फैक्टर्स कम इनटू एक्शन, बट ऑल द क्लॉटिंग फैक्टर्स गेट यूज्ड अप इन द प्रोसेस, जिसकी वजह से पेशेंट को और ज्यादा ब्लीडिंग होने लगती है. दैट इज व्हाट इज DIC. So if I ask you, what are the lab findings which you are going to get in DIC? In DIC, all clotting factors will be decreased, right? Now, clotting factor number 1 is serum fibrinogen. So, what will happen to serum fibrinogen? It will decrease. What will happen to fibrin degradation product? Fibrin degradation product, it will increase. Fibrin degradation product. What happens to D-dimer levels? It increases, right? So these are the lab findings. All clotting factors decrease, serum fibrinogen decreases, fibrin degradation products increase, and D-dimer levels increase. Clear to all of you, bacho? Right? So if I ask you, how can you manage DIC? What will you do to manage DIC? So you tell me, what should be the management of DIC? Management of DIC is you have to give back to the body the clotting factors. That is the management. So clotting factors को वापस देने के लिए क्या करोगे? You are going to give fresh frozen plasma या cryo precipitate. And till the time these things are not available, till that time you can go for blood transfusion, right? So that is what you have, that is how you have to manage a patient with DIC. Clear to all of you? Yes. And I have told you the causes of DIC also. So this completes very important topic, Abruptio and DIC. If you are following Marrow notes and you are following edition 5 ke notes, edition 5 was based on previous edition of Williams. Previous edition of Williams कहता था कि DIC का best management is vaginal delivery, right? जो recent Williams है वो ये कहता है, and recent Williams पे Marrow's 6th edition notes are based. जितने भी 6th edition के video notes हैं, they are based on edition 6. That says that for DIC the best management is cesarean section. So nowadays for management of DIC we go for cesarean section. Clear to all of you? Yes. Okay, so that's all what I wanted to tell you in Abruptio and DIC. That completes a very, very important topic. Now, another very important topic which I want to take up, because I want to combine OBS and gynae, so that ऐसा ना हो कि हम OBS के important topics करते जाएं and gynae रह जाए. I want to take up with you screening for cancer cervix and important points on cancer cervix. So probably on Sunday I'll schedule. Normally I don't take a class on Sunday, but my recordings are going on. So weekdays mein I become a little busy. Sometimes I'm able to take your class. Sometimes I'm not able to take your class. So on this Sunday I will take a class for cancer cervix. So see you all on Sunday. Time again I am going to update you on my Instagram handle. So see you all on Sunday. Right? Take care. Bye-bye. All the best. Keep studying.